So up and coming is Valentine's Day, and I do know that even myself, Valentine's coming up, and I like to a little something for myself. And lips are definitely, especially for me, a small something that I can do that really gives me a very big lift in terms of how I feel. Even just a little bit of filler, and I walk out of there with a big smile on my face.
Is that considered a gift from me when you do that?
Yes, exactly. I hope we both enjoy it. And by the way, no, you cannot feel filler in your lips when you're kissing someone.
No,
nor can they feel it in your lips.
No, you definitely can't.
Never notice it.
I can attest to that.
So Valentine's Day lips. So this is a fun topic. So we did a little bit of research on the marketing team here, and Instagram is always a great place to start. Hashtag research is always fun. And we uncovered 3 trends that I wanted to ask Lisa about from an injectables perspective. And I think that we have about 10 minutes before the rest of our team starts arriving? I think so. So we'll probably wrap up in the next 10 minutes. So the first one we came across, Lisa, was Russian lips. Can you tell us about Russian lips?
Hold on a second. There is something called Russian lips.
Oh, yes.
Lisa, this is me.
Oh, that is so funny.
The Russian doll lip, actually.
Oh, okay. Wow.
Yeah, but I get shown these pictures a lot. Actually, it's usually when we're talking about trends, it's usually going to be the late 20s, 20-year-olds, early 30s that are coming in with pictures from the Instagram of lips that they like, and this is one that I see a lot. So this is a treatment. Hers are a little bit quite rounded, actually. Usually when we're doing a Russian lip, you're injecting from the top and just injecting little columns along the lip to try to increase the show of the pink part of the lip. So you're trying to give a little bit of height, definition along the Cupid's bow, and it's kind of a tall and more flatter lip. And it looks nice in certain degrees. I think when you if you look up Russian lips on the internet, you'll get different degrees, and some people always can push the boundaries a little bit too much, I think, and it can look really done, and it's a restrained Russian lip looks very nice. Restrained. Yeah. Can you please do a restrained Russian lip look for me sometime? I think it looks really good. I'm not sure if my lips would even do that, or we'd need to have beautiful lips in there. Yeah.
It's interesting. It almost looks like the lip has been shortened, because a lot of times when I do a lip lift, I will shorten that distance from the Cupid's bow. It almost looks like that's been shortened, but I guess what you're saying is it's actually been lifted.
Pulling it up. Yeah. And I do that on some older clients too. I don't do a full Russian lip, but I do the columns through the center part of the lip to try to lift a little bit. Yeah.
Right.
Yeah. Interesting. Cool. I like that. I think it looks really nice.
I didn't know there was a name for it.
The next one, Tom, you might like this.
Right.
The next one is cherry lips. Lisa, cherry lips. Cherry lips. That is an Asian trend from Korea. So it's just respecting the fact that the mouth is a little narrower and rounder. They don't want any width laterally. So we're just putting a little bit of product through the center on top, and then center on the bottom, and then giving a little bit more definition to the Cupid's bow, so they have a little bit more shape on the top. Okay. Now, do you think that would look good in most anyone, or? Well, it usually takes a certain lip shape to begin with. I mean, if you have a wide mouth, you can't really do that cherry lip because you're trying to make it a little bit circular, right? Mm-hmm. Okay. Yeah, I see. Are there any things that you're really trying to avoid with lips these days? Pitfalls or? I think really the trend right now, and if you look on anybody's marketing, everybody's trying to do undetectable and really natural looking filler. So I think that is, we've gone through a lot of trends with lip filler, starting with, 20 years ago, the first lip that we were taught to do was the Parisian lip. So that was full body lip and really piping out the outlining of the lip. Mm-hmm. So, 20 years ago, when you took a before picture of somebody's lips, and I think vials were $400 back then. They spent $400, and you took their after picture. They wanted to really see their $400 worth of filler in their lips. They wanted a dramatic difference. And now we've really scaled it back. We've learned from that really isn't a great look on everybody. So we're trying to make things really natural, and we're taking into account that we want the lip to look also natural when people are talking and moving, and not just when it's relaxed.
Right. Yes. Oh, the in motion is very, very important.
Yes. Yeah, we're just trying to keep it subtle, right? Make it look healthy and hydrated, but not like you've had your lips done.
Beautiful. Okay, great. Last trend is the keyhole lip.
Keyhole lip. The keyhole lip was really popular. I got asked for that a lot, maybe a year and a half ago. And when I first came here, that is a little trend where you're trying to, some people naturally have that little sulcus in the middle. So we use a little string of dental floss, tie a knot in the end of it, put it through we could do the top and the bottom teeth, and then pull down. So we're creating a little bit of a blockage there, and we just put filler on the sides of it. So when you take it out, it leaves that little keyhole look.
So do you get the patient to just kind of hold down the thread while you're working?
I usually do. Yeah.
Yeah. Oh, that's cool. Oh.
Yeah.
I would also like to try this.
I'd like to try that. It looks like not on me, but I'd like to,
Well, thank you, Lisa. Now, just to quickly wrap up this discussion with lips, and then we're going to ask Suzanne a question about product. But Dr. Buonassisi, when it comes to lip lift, now I just wanted to clarify, because I know we get the question a lot. Is a lip lift a permanent way to achieve full lips?
Not really. I think a lip lift is designed to shorten the distance, so that from a proportion perspective, the upper lip distance is significantly less than the distance from the lower lip to the chin. That's one reason. The other is that some people don't see their upper teeth as much as they used to. And so what we're doing is we're exposing the upper teeth, and we're also changing, hopefully improving, the proportion of lip length from the upper lip to the lower lip. It doesn't add volume to the lip. It really takes away the cutaneous lip, which, if you don't know, the cutaneous lip is the area from between the nose to the red, and then the vermilion lip is the red part of the lip. So it's shortening the cutaneous lip, and for some people it looks really good, but it's not a surgical lip augmentation at all. I mean, that's not what it does.
Right. Okay. Yes, I do know that this has become a very, very popular procedure in clinic here.
Yeah, and the thing, most of the patients that I see for lip lift, they've already gone through the process of consulting over the phone with us, and our consultants explain to them all of that sort of stuff. So I'm not seeing people that are coming saying, I want my lips to be bigger with surgery, because we've already been, educated about that. Okay. Most of our lip lift patients, that once they've had surgery to shorten the distance, they come back to see Lisa for volume.
Okay, great. Now, Suzanne, we're going to wrap up our discussion of lips with you. And I know that Suzanne is an absolute expert when it comes to the different lines of medical grade skincare products that we use. Are you able to recommend a really great lip product for someone?
Yeah, I actually have two. I don't know whether people are aware of these. Well, go with this one first. The HA intensifier. Oh, can you see it?
Yeah.
One of I'm a huge fan of this product. I use it morning and night. I really put my skin glow down to this. This is hyaluronic acid, but it works in a different way than other hyaluronic acid products out there. The molecule is too large that you can get down to the dermis, where that's really where you want that hydration. So this product works on increasing your own hyaluronic acid production. It reduces hyaluronidase, which is something that we produce in our bodies. That's why our fillers are naturally broken down over time. So it reduces that production. So we're actually retaining and holding on to our own natural hyaluronic acid. So great to use for fillers. It's hopefully going to prolong the lifespan of that. So with this product, you can use it all over your face, but what I do around the lips and also over the eyes and the eyelids. So that's one thing about, kind of holding on to your own natural hyaluronic acid. This one here, antioxidant, it's actually a beautiful skin treatment. So it is a correction product. And this would actually be fantastic for Nikki, because it's really good for chapped lips if she's out running all the time. That's something that can, really support natural hydration. So it's got humectants, emollients. It's going to retain and hold on to the natural moisture whilst kind of working on fine lines. So it's more of your correction product. So even the two of them, the combination would be fantastic for around the lips.
Right. You picked two products that are my absolute favorite. I used them both this morning. Thank you so much to everyone. It's been great meeting and discussing this way. I think we'll wrap up now. We look forward to seeing you next time. And I have a